Thank you. I'd like to start off by inviting you all to think back to 23rd of March, 2020. It was an ordinary morning, nothing unusual, nothing remarkable. However, it was in fact the day the public learned that being at home, binge watching Netflix and waiting for the new James Bond movie No Time to Die could in fact be a public service. Tension rose, anxiety built. It was 8:30 p.m. and nationwide, people tuned in to listen to the Prime Minister Boris Johnson. Then he revealed a nationwide lockdown. Hi, my name is Lochana Suraneni. I'm a Year 12 student here at DCGS. As an aspiring medic, I furthered my research in my EPQ into the NHS and the impacts of COVID on it. This made me question, could the NHS withstand a biowall? Before I go straight into it, I'd like to define what a biological wall really is. In a nutshell, it's when bacteria and viruses are used for threat. Here's the Oxford definition of a biowall. 3,000, 5,000, 7,000. Now you may be wondering, what are these numbers? Perhaps they're the number of toilet rolls bought in a single day during the lockdown. But no. In fact, they're the number of reported COVID cases per day between May to September of 2020. It came in 2 waves, and from a census from 2021, it was revealed the major increase in numbers of COVID cases. Now, to best understand a biowall, it's best to look back in our past. What really went so wrong during COVID? First, it was that a lot of our policies and legislations in place were towards influenza rather than COVID. This meant managers didn't know what to do. The hospital environment built tension. Additionally, there was also a lot of crisis-driven decisions that were made. This led to a lot of moral injury in workplaces. This led to burnout, and this also led to limited recovery time. Now, some could debate that perhaps this was due to a lack of funding, for example. But actually, from a report submitted by the chief investigator by the command of His Majesty to Parliament, revealed that in 2019, 2020, and 2021, the yearly estimate of budget was approximate of 1,200 billion. There wasn't much stagger to do with the yearly budget. Instead, if anything, during 2020, a larger proportion was perhaps dedicated towards the healthcare sector. So, if not budget, what else went wrong? It was also a lack of PPE protection kit and misinformation that was spread during COVID. By a survey from the Royal College of Nursing, it was revealed a practitioner on the maternity ward went 6 months without a mask. And the R number, meaning the number of infected people per person in COVID, was 5. So we didn't really understand the severity of this disease. Now, you may be wondering, how is this all relevant towards a biowall? As I said, it's important that we look back in our past because this isn't a science fiction movie. It's our reality and our future. I'd like to talk about a small island in Scotland, actually. Back in 1947, secret biological weapons was tested on this island. It was known as Grenard's Island. And in fact, here, millions of tiny spores of anthrax were released. In fact, it took 48 years to be able to decontaminate this island. It took 280 pounds of formaldehyde to be able to make it safe. And finally, on the 24th of April, 1990, the government was finally able to deem it safe and take it out of isolation. So if just a small testing of biological weapons could cause such a huge ordeal, Imagine what a worldwide global pandemic with biowars could lead to. Now, let's come to the main question of today. Could the NHS really withstand a biowar? And the answer is yes, but it would struggle. We've come very far from COVID. There have been better legislations and improvements to policies in place. For example, there's the World Health Organization, the UK's healthcare system, the Biological Weapons Act of 1947, for example, which prohibits the use of biological weapons in the deemed a threat. Additionally, in the NHS, there's also been many improvements, surprisingly. There's introduction of corridor care, for example. This means that patients can be seen in A&Es, and this can lead to better patient-centered care and more efficient care in general. There's also moved to a more digitalized healthcare system here in the UK, with the introduction of the NHS app, which I'm sure many of you are using now. So with all these improvements, it's important to see how far we've become. But additionally, I'd like to address this misconception that the government often has. They believe investing in military, investing in nuclear weapons is our future. But instead, as we've seen time and time again, a biological war is more prominent. And instead of investing in nuclear weapons, for example, it's important that we understand that the battlefield is in fact at hospitals, supply chains, and most importantly, and the reason why I'm actually standing in front of you today and talking to you, is the importance of public trust. So why shouldn't we make the difference? Why shouldn't we strive to define our future? Now you may be wondering, what can we, the general public, do to help protect ourselves in a biowar? It comes down to 4 basic things. First, it's that if you feel like you've contracted a new infection, it's important that you report it to your local GP practitioner. Because places and larger institutions like schools and workplaces is where a pandemic is most likely to start. Additionally, it's important that you maintain proper hygiene, for example. Coughing and sneezing to your elbow is a great way to start. Another way is to not panic. This isn't to instill fear, instead it's to bring unity. So look in the correct places, don't fall for misinformation. Like, for example, I know it might be hard to believe, but the Prime Minister, Boris Johnson at the time, believed it was better to let it rip, and he basically thought that building herd immunity through that way instead of vaccinations was better. You can see how misinformed he was and how dangerous it was when the public also listened to this. Another way is to watch out for emergency alerts on your phone. That is the best way the government will be able to alert you in the case of an emergency. And most importantly, again, I come back to this key topic and key idea of public trust. So to conclude, I'd like you to think back to the time where we clapped to show appreciation towards healthcare workers in COVID. So just as we brought our hands together, I ask that we unite our voices and build health literacy in England. Remember, this isn't to instill fear, instead it's to improve unity, build community spirit, and I'd like you to think about this. If you believe a safer and more informed future is better for us, I'd like you to raise your hands now. Thank you. And this is where the change starts. Thank you for listening.